Good morning, everyone, and welcome to this press conference we have to present some really important and good news about what's going on in the state. I'm Ed Ellinger, I'm Commissioner of Health. I'm also a physician, and in my years of practice have practiced in an independent practice, a solo practice, and also in an early version of a healthcare home. And I know from my personal experience that it really makes a difference if you're working with a team, if you're working in a team that has a community orientation, that you're really working to integrate what you do as a primary care doc with the specialists and the hospitals and the social service. It makes a huge difference. And so I was really pleased when the state several years ago decided to really embark on this healthcare home initiative. And we're here to report about what we found out about healthcare homes. For those of you who are unaware, Minnesota's Healthcare Homes is a joint initiative of the Minnesota Department of Health and the Department of Human Services, where primary care clinics that voluntarily meet a set of standards are certified as healthcare homes and then are eligible to receive some care coordination payments. And the goal of the program is really to connect, it's patient-centered, so it's to connect patients with the services that they need to be optimally healthy. So we're presenting the results of today of two reports. One of the reports is a joint legislative report from the two departments, Health and Human Service, and the preliminary findings from a University of Minnesota study that evaluated the performance of healthcare homes from 2010 to 2012. The MDH-DHS legislative report found that primary care clinics continue to embrace healthcare homes throughout the state. As of December 31st of last year, there were 322 certified healthcare homes, representing about 43% of Minnesota's clinics and serving 3.3 million people. Approximately 353,000 Minnesota healthcare programs, public program participants, receive care in healthcare homes. In addition, 100% of the clinics that have been certified as healthcare homes have decided to get recertified, which I think is really a remarkable endorsement of what's going on. And certainly as I go around the state talking with the providers in healthcare homes, and particularly talking with patients in healthcare homes, there's great enthusiasm for this approach. A few problems that we still have to be working on, which you'll probably be hearing about, but I think in general this is an approach that we're really working well in this state and really has a lot of promise that is being realized right now, but even more promise in the future. The level of participation homes, which strives to make better care easier for patients, has made Minnesota really a national leader in this patient-centered, team-based care. So in addition to what we're reporting as their two departments, the University of Minnesota study will show that clinics that achieve healthcare home certification have higher quality scores than non-healthcare home clinics. Healthcare home clinics also improved access for populations of color at a lower cost for Medicaid patients. Higher risk patients, populations of color, higher quality care, lower cost, better patient satisfaction. I mean, this is the way to do the triple aim, and that's why we're building a lot of our health reform activities on healthcare homes. A lot of the work we're doing with the state innovation model is going to be built on healthcare homes. So in short, healthcare homes are doing what they were intended to do because they continue to serve the foundational elements of Minnesota's healthcare reform efforts. The model focuses on disease management, prevention, and community care teams that connects clinics and communities in allowing healthcare homes to serve as the cornerstone for additional healthcare reforms. It is our hope that we can build on healthcare homes to improve coordination among healthcare with behavioral, community health, social service, and public health systems. The integration that really makes a difference in overall health. And now, as I said, there are still challenges involved with healthcare homes. Moving forward, we need to make sure that the clinics have the support that they need to continue this work on behalf of patients, because it is not easy to be a healthcare home, as I think we will find out, but the work is worth it. So we need to give them those kinds of support. And it's also important that we get all of the state's healthcare payers on board, particularly some of the large employers in the state who with self-insured benefits. We're demonstrating that it really works, and if we really wanted to expand, we need all payers, a multi-payer approach to healthcare homes to really advance this to the next level. Because I think our data from the evaluation and from our experience this is the way to go to improve quality, improve patient satisfaction, and lower cost. And only by doing that will we be able to be the healthiest state for all people in this state. This also shows the fact that earlier this month we put together our health equity report. Healthcare homes are a way of really advancing health equity.